Okay, so, hang on a second. My, okay, there we go. My videotape stopped. So, okay, so I think where it stopped was that we were just watching that doctor talk about glaucoma. And so he was just saying that the best way to treat this is through prevention. So this is why you want to get your patient to get their eyes checked at least once a year. The doctor will check the pressure inside the eye. Okay, so that is glaucoma. Now I wanted to talk about cataract, which is the was the other video I showed you a little bit early. But cataracts is basically the lens of the eye that is getting too opaque. And it starts, instead of being nice and clear, it starts to get cloudy. And if it's not treated, it can actually lead to blindness. In the United States, it's really simple to treat. I'm going to show you how we treat it. But this is basically what's happening is in a normal eye, the image comes in through and then with the light it projects an image onto the back of the retina, and this is what I was talking about, both near and farsighted. In a nearsighted person, the image is actually ending up too short. In a farsighted person, the angle comes back here, and that's farsighted, so they can't see things up close. But anyways, that's just near farsighted. But in a person whose cataract starts getting opaque, this is what happens. The light comes in, and first of all, they have a harder time narrowing down the light, and then it just shatters across the back of the retina, and it creates this kind of image. The lens will start looking like this. The vision starts getting sort of like cloudy looking, but this is the problem. The good news is, unlike glaucoma and macular degeneration, we can fix glaucoma. I mean, we can fix cataracts, and we can fix it pretty easily with surgery. So this is the one I wanted to, I have another video I wanted to show you on cataracts. This is really cool. It's about a 5-minute video, and
this is Dr. Sydney Tyson.
Shows you how to do cataract surgery.
I'd like to share with you this 5-minute video on cataract surgery. Kind of share with you how we do it and try and take some of the fear out of cataract surgery. We initially make a little incision in the cornea, which you can see is blood-free, and inject a small amount of anesthetic to numb the eye. There are no needles used in this procedure. We then make the initial incision, again without any blood, and it's about 3 millimeters in length, very small. We add a lubricant to the inside of the eye to protect the cornea, and then we gently peel back the front surface of the lens. The lens is like a grape, where there's a skin and pulp. We're removing the outer skin to allow access to the pulp inside. We loosen up that pulp, which is the actual cataract you can see moving with this fluid as we irrigate it throughout the lens material. We then use an ultrasound instrument to break up the cataract. This instrument vibrates approximately 50,000 times per second and does a wonderful job of disassembling these brittle lenses in many cases. As you'll note, there are no lasers used for cataract removal. It's a common misconception. So what this device does, as you can see, it slowly but surely removes all the lens material. This cataract that has been formed is slowly going away with these little bites. This is absolutely pain-free. You can see that dark brown material start to disappear. there's a high suction that's associated with this device, which then removes these pieces as they're broken up. And you can see the lens slowly disappear. This is what we would consider to be a moderate to fairly dense lens. So the majority of the pulp of the grape or the lens is gone. We use then a secondary device called an irrigation aspiration device to remove remnants or fibers of lens material that are left over. And we're very careful to remove as much of this material as possible. And what's left, after all this material is gone, is a sac, which we call the capsular bag. And now within this sac, we're going to place some more lubricant in order to expand the sac to allow for the placement of the intraocular lens. This lens goes through the same incision, approximately 3 millimeters, is foldable, and is gently inserted into the capsular bag to replace the lens that was previously removed. This restores focusing power. Many people ask, do I need to have an intraocular lens placed? And the answer is yes. Otherwise, everyone would end up with thick cataract glasses or contact lenses after cataract surgery, and that's outdated at this point. These lenses restore focus. In the monofocal variety, it is good only for distance, and most people need glasses afterwards. But now with the advent of modern technology, we have multifocal lenses which allow great vision at distance, intermediate, and near. We close the wound simply with a salt solution. You can see that there are no stitches required. And that is cataract surgery. Very simple, very straightforward.
Okay, how cool is that? So that is a very common procedure, a very quick procedure. A lot of your patients will have this done. And a lot of people, if you end up doing like Nurses Across Borders or Doctors Without Borders or working on mercy ships or something like that, a lot of developing countries don't have access to these things. And so you might go with a team of ophthalmologists and assist on these, because a lot of, like that other doctor said, a lot of children in third world countries are born with cataracts, or and it's so simple. It's such a simple way to restore vision to people. So one thing that you need to know about as a nurse post-operatively, you don't want your patients bending over, you don't want them sneezing, you don't want to do anything that's going to increase that intraocular pressure. No heavy lifting for a while. You need to keep them upright, just because you don't want that lens slipping out of place. Sometimes the lens will get a little bit opaque. Afterwards, it might get a little bit of scar tissue on there. They can fix that, no problem. But if it does start having cloudy lens, they do need to go back to the ophthalmologist and tell them that. That's just a little bit of a scar tissue that can be fixed with lasers. So those are just some things. But other than that, there's not really a lot of complications or anything for patients who have cataract surgery, which is kind of nice. Okay, so I'm going to stop that one there. That's the end of eye stuff. That's really all you need to know. There's not a lot of other stuff. Occasionally you get a stye in your eye or some infections, but that's, just throw some antibiotic drops in there, and that's not usually a huge issue. So I think that's about it that you need to know. Those are the big things I want you to know about eyes, retinal issues, glaucoma, and cataracts. Those are the big things we deal with, other than like vision problems, like I told you, like with the 20/20, which everybody's got vision problems, but those are easily corrected with glasses and follow-ups with your eye doctor. So, all right, we're going to end it there, and then I'm going to do a little bit of hearing, and then we should be done.